AAA staff.
All right. Well,
Wait, could you please stop her from making that comment? This is Jason. Can you please stop her from making that public comment?
Yeah, right. Okay. All right. Do we have any other members of the public before we get too far along here?
I haven't seen any.
Yeah, we haven't seen anybody on the board.
I see Kathy. I see Jason. I see Jolene.
And Joe's here, Joanne.
Hi, Joe.
Marilyn here.
All right. And Rosemary. I see Rosemary from the Alzheimer's Association.
Phyllis is here.
Chris Larson's here.
Okay, hold on just a moment here, because we're going to go through a formal roll call in just a moment. Jess will be doing that. So Jess is going to start us off actually with some housekeeping, so that we're not tripping over each other in this meeting, which we have found it can be easy to do in a Zoom meeting. So Jess is going to give us a rundown of some housekeeping, and then she's going to be muting everyone and then opening. So she's going to manage our meeting today. So Jess, if you'll move forward, leave me and Dixie open for the time being.
Okay. All right. So just a little bit of housekeeping. We'll teach you guys quickly how to use some of the features on here. So you'll see if you hover over your screen, it pops up with a little box to be able to mute yourself. So you'll want to use that feature and turn yourself off. You'll see a red microphone with a slash through it, and that means you're muted. To speak, you'll need to hover back over your box and click the mute again to unmute yourself. And so that helps it keep the ambient noise at bay. That way everyone can hear. We don't get the feedback and ringing as each other talks. There's a couple of other little things you can do. There's a reaction button. It should be at the bottom of your screen. And this will allow you to do a thumbs up or a high five or wave if you want to speak. Those are nice to use. You don't have to. Just letting you know they're there. There's a chat feature that you can use. If you've been able to find that yet, I believe that's also at the bottom of your screen. It says chat. That will pop up a white text box to the side of your screen, and you can send a message to the whole group or to a single member there. Pretty helpful. So as far as other housekeeping, public comment, as we said before, if you can send those by email, it keeps it a little bit less sloppy. We can read those off and make sure our time is maintained properly here and effectively, efficiently. If you're not speaking, mute yourself. Remember that some people only call in. They do not have the screen access that you do. So if you are describing any items, make sure to just be clear, concise. Not everybody has the visual. No committee reports today and no presenters, so it should be pretty straightforward. And then we'll do a quick roll call, and I will turn it over to your chair. So I saw B today, B Babbitt. And if you're here, you can. That's good. Dave. It's a good way to test your features. We saw Dave, so if you want to try it out, you can. Hi, Dave. Bill from Park. I saw Bill.
Here.
There he is. All right. Andrew.
Yeah, good morning. I'm here.
Good morning. Lucy. We have Lucy.
I'm here.
Do we have Lucy?
Yeah, I'm here.
Oh, hi. No, there you are.
Hello.
Your square was hiding. Okay. Jen Nemo.
I'm here.
There you are. Perfect. Okay. Carol Parks.
So Carol was planning on being here, but she ended up having her physical therapist arrive at 10 o'clock this morning. So she's kind of doing okay, but she is gonna miss a meeting and says hello to everybody.
All right. Joyce Whittle.
I'm here.
There's Joyce. Great. Dixie Wodell.
Yes, I'm here.
Hello, Dixie. Chris Larson.
Here. Can you see me?
Can see you. All right. Elaine McKenzie.
Good morning. Elaine is here.
All right. Let me. And as we go through, I change people's phone numbers to reflect their name. That way you can tell easily who's speaking. So you probably will notice that happening. So after Elaine, we have Marilyn Bradish.
Yes, hi.
Hello, Marilyn. Marilyn Massey. Other Marilyn today?
I know she was going to try to, so I think she might come on in for a couple of minutes.
Okay, we'll keep an eye out for her. And then Joanne Ruth.
Yes, I'm here.
There we are. Fantastic. Okay. So let's see. Did I miss any members of the committee?
Wendy.
Wendy. Yeah, I did. Where are you? Oh, I skipped right over you between Lucy and Jeff. Wendy. Hello, Wendy. Gotcha. Anybody else on the committee that I did not call? And then I'll go through our guests and other people that are joined into the meeting. Okay. So I also show Rosemary Harmio for, I believe, Alzheimer's. Jason DeBueno is on the line. Melissa for PPACG. Jody for PPACG. Andy Gunning for PPACG. Jolene Houseman is on the line. She did have a public comment she'd expressed earlier. Let's see. Bobby Gore is also on the line for Park, I believe. And then we have PJ. Is this Pamela?
Just visiting.
Hi there.
Hi there.
And then we have one caller in, if you can identify who you are. It's 719-633-4601.
That's Dave Summers.
Hello, Dave.
Hey, Dave.
Okay, I believe that's everybody. If I did not call you, if you shout right now.
Kathy Lowry from Teller Senior Coalition is on.
Hi,
Right.
Kathy.
Perfect. Okay, so that should be everybody. Like Jody mentioned before, I stay on, I kind of mute myself, hide myself in the background and monitor as things are going on to make sure you're being able to get through, be seen, to talk, stuff like that. So if you have a question or comment, you need help, you can send a chat message on the side and I'll help you there. And then other than that, I turn it over to your chair.
Hi, am I on?
You are.
Sure.
Yes.
All right. So the meeting is called to order and we do have a quorum. Welcome, everybody.
Thank you.
Thank you.
Good. Okay, so our consent items are the agenda, which some of you have had trouble downloading, but
Good job.
our agenda and our minutes we're going to do act on as a whole. So want to know if there are any changes or additions to the agenda or the minutes. No changes, no additions. Okay, so I need a motion to approve the agenda and the minutes as they are.
I motion.
I second.
All right. Any discussion? Okay, all in favor?
Aye.
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 And who was the second? Who seconded it?
Marilyn?
Thank you. And that's Marilyn B?
Yes.
Thank you.
Okay, so it's carried. Public comments. Do we go ahead with any public comments, Jody?
As long as we can keep them to 2 minutes or less, we can go ahead since we do have some members of the public. So let's see, I'm going to, let me just reopen my screen here. See who all else is on here. Whoops, that's not it. Okay, so I understand, just a quick note, I understand Jolene had a public comment. Jolene, please go ahead.
Thank you so much. I just wanted to call in and let the RAC members know what a phenomenal job PPACG and AAA staff is doing to support all the local agencies during COVID. They have been extremely responsive to every email, allowing us to shift funds around per federal guidelines to ensure every senior is still getting to medical and dialysis appointments, in addition to not being able to go to congregate meals, assisting with ensuring people can do drive-through meals or supporting us to deliver meals to those that don't have transportation, and supporting us to allow Fountain Valley Senior Center to do calls of reassurance to all 850 of our members. And we called everyone and left a message or spoke with them last week. And going forward, everybody that wants phone calls will get one at least once a week, if not more. And the City of Fountain, 36 staff members that work for the City of Fountain are donating 100 hours of their time to help every week to help us make those calls. And the seniors that particularly live alone with no social interaction are just so grateful for these calls. And so I just really wanted to express my gratitude to PPACG, AAA, and the RAC Committee for just your continued support through COVID and ensuring that our seniors are still getting social interaction while they have to stay at home. Thank you for letting me do a public comment.
Thank you,
Invita
Jolene.
says here, here.
Okay, thank you, Dave. Jason, did you have a public comment?
No, I would just echo what Jolene has said. Just thank you so much for all the support.
Great, thank you. Kathy, do you have anything?
I would have to say the same thing. It's been wonderful to have all this flexibility to help out our seniors, and I think we're all rising to the challenge.
Thank you, good to hear. Let's see, Bobby, anything? Okay, let's see, is there any other member of the public who wishes to share at this moment? Okay, public comments are closed, so Chair Dixie, please, you can keep going.
All right, great. Informational items. The information we have today is no presenters, no reports. So you get lots of information, but we do have the director's report. Jody, we're excited to hear about all of the monies and good things going on.
All right, thank you, Madam Chair. Yes, as you might imagine, it has been a whirlwind, an absolute whirlwind. So I'll just start. When we last were together, that was the February Providers Fair, and there were already some really high-end discussions already touching about concerns around COVID and closures and access to material goods and food items. And so those, I will let you know that some of the providers that were there were already expressing concerns and as it might relate to service delivery. And so we were already in discussions even at the end of February, early March. Just to give you a rundown, kind of a picture of what has happened with the Area Agency on Aging offices and the PPACG overall. We closed our doors to appointments only, and the week of March 11th, March 12th. And we're very cautious about entry by the public. We were still serving the public. We had signs on both doors, upstairs and downstairs, encouraging people to call us so that we could serve them by phone. It was determined on Tuesday, March 17, to go ahead and more formally close the offices and send staff home to work remotely. She was on a few minutes ago. I don't know if you saw her, but some of you know Jenny. She is our IT director, and she has just been a firecracker. By that Tuesday, she had us all set up electronically to work remotely. We had either our computers set up, home computers set up, laptops set up, phones, emails, the works, and the Zoom meetings as well. So we even had a training at noon on Tuesday, the day we closed, how to access one another via Zoom. And so it all really happened fairly quickly. The culmination of all the planning came about very quickly. And like I said, by noonish on March 17th, we closed our offices. Now, I'm so happy to report that despite closing, and those of you who can see me by camera can see me using some air quotes there, we never really closed. All of our staff have the remote capability access through the great work of Jenny, our IT manager. But not only have we been able to maintain our regular working schedules, our regular working roles and expectations as providers internally, this has enabled us to continue supporting, as you've heard from some of our providers, supporting our providers either by Zoom or telephone. I have given out my personal cell phone to a variety of people. I've given out access to, we've done these Zoom meetings, we've done these phone calls, just making sure people have access to determine when things are okay to change around as it relates to services, which we'll get into more of that. As you might imagine, my report today is going to be much longer than our normal meeting reports. So bear with me here as we get through this. And I'll open up for questions. If you'll hold any questions you have to the very end, just make a note, and that way we can go around the group. March 17th. So here we are. We're now almost 6 weeks later. Not only, like I said, have we maintained our regular work roles and outreach to the community, supporting our providers, we have also, much like Jolene described that they're doing at Fountain Valley Senior Center and with the staff of the city of Fountain, we also went through working backwards from our contact lists, folks who normally would just maybe walk in and have questions about their Medicare or have questions about their insurance. We began working backwards through our contact lists, and our case managers and insurance counselors have been making calls of reassurance to all of the folks that we have worked with. And like I said, those calls continue because, as you might imagine, when you really put, when you think about what we do within the PPAAA, sometimes the folks come to us, especially if it's around insurance or Medicare, or just picking up materials there in the front lobby. They come in, they ask a few questions, and they leave. Or they sit down for an appointment, they get their questions answered, they leave. We don't necessarily see them again until either the following year, when it's time to renew or reselect portions of their Medicare insurance, or provide guidance to, because of a a change in their circumstances. But those people who come to us many times are not necessarily also seeking out services through some of our other providers. Some do, but some don't. So some people walked in, you know, let's say they walked into our office in February, got their questions answered, and then left. They could do their own grocery shopping. They had capacity to drive to the grocery store or Walmart, go to the doctor, whatever those scenarios are. Now, all of a sudden, we're saying, stay home, don't go to public places, and we will bring the services to you either by phone or by transportation through one of the providers. And so, as you might imagine, the Older Americans Act is all predicated on independence and reducing social isolation. Well, COVID-19 has completely turned this upside down. We are no longer operating in a situation where it's safe in many cases for our clients, either directly from us at the AAA or through our providers, to be out and about. We want them to stay safe and healthy at home, which leads to social isolation, right? So everything that we have been doing, either through the AAA or encouraging our providers to do, is find ways to reduce that social isolation. So I wanted to give you a brief update as to some of the funding situations that were described by Jolene and Jason and Dave. The Administration for Community Living, which oversees the Older Americans Act funding source, created what they call the Family First Act. I don't have the full amount that came to the state of Colorado. I believe it was around $3 million. The portion for our region was a little over $420,000. It was immediately to be placed and provided to service providers who were doing food and home delivered meals, congregate meal programs, emergency food delivery, that kind of thing. And it was very, very specific, and it was to be provided as quickly as possible. So in the month of March, we were able to, through a series of conversations as well as some needs assessments, determine, pardon me, just looking through my notes, determine those meal providers. And so for us in our region, out of the providers that we have across the 3 counties, that's Teller Senior Coalition, that's Park County Senior Coalition, and Silver Key. We asked them what services that they have seen needs to modify as it related to the meal provision for seniors. We asked about what those additional costs were looking like as it related to that service delivery. So a couple of scenarios I'll share. For example, Silver Key, as you know, has a variety of congregate meal programs throughout our region, primarily in El Paso County, where they deliver meals, hot meals, to congregate meal sites. Most of those are in apartments, apartment buildings, senior centers, churches. People congregate, they have their meal, they go home, or they stick around for services. Early on, the congregate meal programs were modified where there was some separation, some additional spacing between clients. There were opportunities for increased sanitation. They took extra measures to make sure that that those measures were in place. It turned very quickly from we're going to modify how we deliver these meals to shutting down those meal sites entirely in the traditional congregate meal format. So Silver Key, for example, is now doing what we're hearing statewide simply called grab and go. And those, you've probably seen the pictures in the newspaper. There was a nice big spread and an article in Monday's paper. And they had a picture at the Colorado Springs Senior Center where people were lined up, properly socially distanced. Coming in, they pick up five meals along with some perishable items. And the senior center staff is also providing some busy activity type things. So the lady in the picture is also carrying away a puzzle. And so that's what they've done with many of their sites. Silver Key also closed their pantry and pack those pantry commodity boxes and now deliver those to their clients instead of bringing the clients out into the public. Teller Senior Coalition, for example, doubled up in all of their home delivered and meal boxes that they would normally deliver once a month or twice a month. They doubled up because their big concern was the loss of drivers. And so very early on, they started to deliver extra meals to make sure that seniors were provided for, including cleaning materials and toilet paper. They got down to, they went past the food items and got down to the practical items. So we appreciate that. Park County, same thing. They are increasing their home delivered meals to make sure that seniors do not have to leave their homes to get goods and materials. And so we appreciate all of them. Those also in some cases included additional sanitizing supplies, boxes and packaging materials for those freezer meals, for example. And so these conversations are ongoing with the providers. We're now looking at all of our providers and any increased needs so that we can access this emergency funding. The exciting thing I would also add to that is our providers who, maybe they aren't a meal provider. They provide transportation, or they provide some sort of counseling services or evidence-based exercise programs. We are working with every single provider to determine what their current situation is, as well as what do things look like moving forward across the next 90 days. The next 90 days is the figure we're using because that brings us through the end of June, which is the end of the state fiscal year. So right now I am up to my eyeballs in emails and forms and phone calls, working with every single provider to determine what their needs look like across the next 90 days. We're being especially proactive, looking along with the providers at their programs that for all intents and purposes just aren't happening right now. They've had to completely shut down, and figuring out where we can move those funds so that they are in areas that they're seeing either an increase or something new. So for example, we have one newer provider this year who contracted with the Area Agency on Aging for transportation dollars. Well, that program essentially is shut down. We were able to, under some of the additional allowances under the emergency funding, we were able to pick up that funding and move it directly into counseling and mental health services because they're already seeing an increase and expect those increases to just continue as people are needing to stay at home. So social isolation, for those of you who have known me for a while, have known and have heard some of my presentations, social isolation, as many of you know, is as serious as many diseases. And we are really challenged in this time to reduce that social isolation, because normally I would say go to the senior center, get involved with a group at church, find a neighborhood group to be acquainted with, and we don't have that. We don't have access to that right now. So there's a lot going on around reducing that social isolation, whether it's by the phone calls being done by the providers or the increases in counseling services, so that seniors have access to those kind of things that they might need. So there, the largest funding stream, emergency funding stream, you've probably heard of it. It's called the CARES Act. And that will bring in to our region a little over $1 million for these emergency services related to COVID-19. We were also just made aware this week of another very small package, comparatively speaking, of funds specifically around information and assistance and reducing social isolation in the amount of about $63,000. And so we've presented this information to the board of directors and have received a green light to move forward in assigning the emergency funding. Right now, we're blessed to have more funding than requests. However, that's today. And the concern, as we're hearing from the state, that congregate programs, whether it's meals or senior center programs, anything like that, where we have larger groups of seniors in particular, those programs, we're being asked to plan. And we're very fortunate. The state has included the providers on calls every week so that they can hear directly from the state unit on aging with the different divisions. But right now we're being asked to plan a minimum of 12 to 18 months out in changes in our regular programming. And there's the possibility that some programs may not restart until there is a vaccine, which could be. In fact, I'm actually in 2 meetings today, and a meeting that's going on that I started with this morning. They were talking about a potential 4 years before a vaccine could be viable for this. So what that means for us as a AAA and what that means for our providers is a complete revisit of past programs, current programs, and what those programs look like moving forward. A couple of challenges that we really expect, and the ACL, the Family First monies that I mentioned, the CARES Act funding that we're expecting really at any time, the ADRC additional information and assistance dollars that we expect very soon. These are all really great things. And one thing that Congress allowed when they signed in the CARES Act was full flexibility in usage of the funds. So those of you who have been on our TRS committees in the past, or you had a quiet day and you read the policies and procedures manual from the State Unit on Aging, know that there are very specific silos, categories of funds allotted from the state and allotted from the Older Americans Act. Traditionally, some of those silos can intercross funding streams, several cannot. In addition, most transfers of funds, so let's say we're getting into the third quarter of the fiscal year, we would normally be allowed to transfer up to a specific amount of those funds from one silo to the other in order to cover funding shortfalls or increases in services. As you might imagine, those that is an extremely complicated process, and the CARES Act allows us to move those monies as needed, when needed, and they do not have to be used in their direct silos. So a perfect example is early on when Silver Key and Fountain Valley and Teller Senior Coalition and others who have both transportation and meal delivery programs found themselves not transporting seniors. They needed to transport boxes and bags of food to their seniors. This allowed us to say, yes, instead of transporting a senior, you may transport that box of food to the senior and still get reimbursed for that. So that's the kind of flexibility that we have seen from the state and the federal government. I believe Silver Key and several other organizations have been able to join us on those provider calls on Wednesdays. And the flexibility that we have been given in this very unprecedented time is unbelievable, because it allows us to meet needs almost immediately, and like I said, move those funds around so that providers can redirect and change up their services to meet the needs of the clients. So a couple of challenges. Statewide, we've come to the state of Colorado. This isn't aging services. The state of Colorado is expecting a 1 to 3 billion, that's billion with a B, boy, billion, $1 to $3 billion shortfall in the budget. As you know, legislators have not been in session. They're expected to return to session May 18th. One of their first tasks when they get back to the State House is to pass the long bill. That simply means to approve the budget and move forward. However, all departments across the state, including CDHS, that's the Colorado Department of Human Services, which oversees the area agencies on aging and the state unit on aging, are being told to expect deep and drastic cuts because of that $1 to $3 billion shortfall. So what does that mean for us as a AAA and AAAs around the state? Those of you who've been on the board for a while or just come to hang out at our AAA meetings have heard Joe say many times, and I have added to that across my presentations, that we as a state have been very fortunate that our AAA dollars are higher from the state of Colorado than they are from the feds. Because of this $1 to $3 billion shortfall expected going into next year, we expect some pretty drastic cuts from the state funding side of the equation. And so we've already now been asked and been told to expect that a portion of the emergency funding that is coming our way may end up being needed to be used to shore up the state, the missing state funding. I'm sharing that with you because, frankly, every day changes. I spend, and my staff spend all day on phone calls and conferences and conversations with the state to determine not just how best to use the funding, but how to plan our AAA services moving forward for our region, and not just the next 90 days, not just the next fiscal year, but really long term. And so I'm sharing that with you because that is obviously an enormous concern. Because of the emergencies around COVID-19, those of you we did touch back in February very, very briefly around the RFP process coming up for the next fiscal year. We do have a clause in our contract with all providers that allows us as an agency to carry over the contract for 2 months. We've opted to do that to allow our providers not to have to stress over an RFP process in the middle of all of this chaos, frankly, because every day feels chaotic, but not to have to worry about the RFP process during this time, because last 2 Fridays ago would have been the original deadline for the RFP process. By opting for the 2-month carryover, that puts our RFP proposers conference to May 12th, with our deadline for RFP submission up to May 22nd. So the goal with that is obviously to give a little breathing room to the providers, as well as us. We did also just receive information from the state yesterday that they are also enacting their 2-month carryover with us as AAAs. And so we'll all be on the same schedule at that point with the new fiscal year. The fiscal year doesn't change, but the new contract year will now be September 1 instead of July 1. Those of you who are on the TRS committee, you'll be receiving an updated RFP schedule with TRS meetings now to be planned for between June 12th and June 26th. And frankly, we don't know if that'll be in person or if that'll be by Zoom, but we will cross that bridge when we come to it. As I mentioned, I'm working on a daily and really hourly basis with our current providers to determine, process those needs assessments to determine what their needs are, what their fund sources are, and where we need to make changes. That's all I have right now. I will open it to questions by the board.
I have a quick question for you guys, Jody.
And so, thank you. Chris, anybody that has questions, since we do have some folks who don't have the video, if you'll just, this is Chris Larson and go for it.
My name is Chris Larson. I represent Park County. One concern specifically about your discussion, Jody, was the CARES Act and some funding possibilities. We have not had a lot of support in our area for tests. It's actually almost impossible for people to get tested for COVID. It took a Southwest Airlines contact through my husband for me to get tested. And because he is essentially an essential employee. So I don't know if there's any means to spread that testing capacity out. And it's amazing to me how that was not represented in the media. So as far as funding, being able to get some tests to the rural areas would be wonderful in regard to the COVID option. And then also in general, as far as support for food closets, food pantries, and deliveries, we ended up having a pretty bad emergency issue here. For some reason, Food Bank of the Rockies actually supports one of our food closets in this area called Widow's Oil. And they shut them off from any type of emergency food. We're not bringing it. And it took about 3 days of phone calls to make some progress and get them back on the list. So still maintaining a concern about what follows through to the rural populace is a very important issue. And then, as you all know, we got very involved in the census, ended up getting a nice loan from DOLA, and everything fell apart. And I don't know if anybody's looking at the results, but we're not in the rural areas, we're not getting a lot of response, even though we ended up putting a lot of effort into it. So I was kind of curious as to how the two things specifically, how we can look at maybe getting some more funding for some active tests in the rural area, and then also what the results are as far as how the census count will be affected, as far as if it'll affect the AAAs, because it's certainly going to affect us when we're looking at federal dollars.
So I'll jump in there. As for the COVID-19 tests, the specific CARES Act funding that the AAA will be receiving cannot go to testing. It's for increases and management of the Older Americans Act programs. And so we won't have the dollars that we'll be managing specifically under AAA. And I want to qualify that because there's also some concerns about how CARES Act fundings are being used, but ours specifically coming down through the Administration of Community Living is specifically for the changes, the emergency changes and changes moving forward around service delivery. As to the food banks, I think that's a conversation maybe we could take offline. I'd like to hear more. I don't know. Right now, because there are so many unknowns, we're looking at where we can filter funds directly to service providers. Okay. However, I think it's worth a conversation to see if we might be able to filter access to funds through providers ultimately to third parties, as long as they are still meeting the needs of seniors. So again, the funding we're receiving, while it still has its specific qualifiers around provision to senior services and us from a operational and contract standpoint are going through our providers and making sure that they have what they need. I think that the additional flexibility may be worth a conversation. And, you know, frankly, that conversation may say, yes, we figure something out, or no, but let's get you connected with someone else. So let's plan to have that conversation separately. I think it's very worthwhile. And then the census results. Yeah, that, as you know, I know Teller County and Melissa with our agency and you guys, the census programs just tanked because of the timing on this. I know I saw a figure from Teller County saying that they'd only had something like a 13.9% response rate. You know, they're desperate to get people getting their census reports done. So at this point, I think that it's definitely valid, because this is really going to hurt us for the next 10 years. Whatever we can do to encourage folks either in leadership roles, to encourage those, you know, despite the time that we're in. And frankly, you know, there's no excuse for nobody doing their census report, because we're all at home. But yeah, it's definitely worthwhile. I'll see what we might have capacity to do through our communications department, and see if that's something we can kick off, because we are going to be coming to a hard deadline very soon. I believe July 1 was is the current and normal deadline. I have heard talk of at the federal level of extending that because
Well, I
of
think
the COVID changes.
There has been some formal change. We're getting some announcements that they're extending stuff out to August. They're waiting to send out the actual door knockers because of the COVID issue. One of the things that we were concerned with as far as funding goes, we ended up getting a grant. And for some reason, we spent a lot. We ended up changing our focus from the social input to actually doing marketing, doing more banners, more exposure, more flyers. Wonderful response from all the merchants that were willing to do that. But what we ended up running into now is DOLA has not extended the deadline for us to extend it past this delay. So if they put a deadline on us and say, hey, you haven't spent this last $5 grand, well, we were waiting to spend it to do a big social push once there was some capacity, then that may turn around to, hey, is there another source for funding if we're going to have to give that money back?
All good conversation to figure out there. Yeah, we'll work on the press release side of things to encourage people to get that taken care of. I would also, especially for those of you who are on the line that provide information and assistance, direct phone calls of reassurance, whether you're on the board or at the public, I would encourage you to include that in your conversations because ultimately a 30-second reminder could, let's put it this way, a 30-second reminder will bring $2,600 into our region if they complete their census. So I would encourage all of us to be active on that. Thank you, Chris. Any other questions for me?
This is Dave. Can you hear me now?
Yes,
Dave,
thank you, Dave.
Hi, up in Tri-Lake. So just piggybacking on what Chris was saying, you've probably already done that. PPACG is probably a very good venue as well to get the word out on the census. So at that level, they're dealing with a lot of the jurisdictions, county and municipality. So I think it'd really be worthwhile to stress again, or continuing, that in fact the census is a very, very big and important piece, despite everything else that's going on, because it has a direct and lasting impact on AAA and the service providers and our seniors.
Thank you, Dave. Any other questions or comments from the board? All right, hearing none, I am going to hand it off to Dixie as chair for her report. Thank you, everyone.
Thanks, Jody.
Okay. Am I on? Not.
Yes, you are. Thank you, Dixie.
All right, great. Thank you. I really don't have a whole lot to report because, like everybody else, I've been staying in place. The highlight of my week is to go to the grocery store. But we did do a virtual board of directors meeting, and basic services to seniors that need them are really playing a big part. What I'm hearing from seniors is that we're all getting cabin fever, and there are some seniors who definitely need help, but there are other seniors like myself who are over 75 that are being encouraged to stay in home for the next month. And I disagree with that comment because the seniors over 75 are the ones who do a lot of the volunteer work in the community. And not all of us are in a delicate category. I don't consider myself as being somebody who needs to be taken care of. Having said that, that's my personal thing. That's not necessarily a report from anything. So really, I don't have anything else to add to that. So I do want to add that in March, we didn't have a meeting because everything was shut down. And at that time, there was no capability or authority for remote or virtual meetings because the board had not approved that until their April meeting. So now that it's been approved, we can meet virtually anyway and do remote voting. So we don't go moving on in the agenda. We don't have any action items, nothing to vote on at this time. Are there any other discussion items?
If I may, Madam Chair, this is Jody. Just to be aware, as you know, the stay-at-home order will lift on Sunday and the safer-at-home order will go into place. There are some qualifiers as it relates to business and offices. At this time, our office doors will remain closed, but our services will continue. We're figuring out what a phased in return to the actual physical space on Chestnut will look like. So please, please know that we're working toward that. But if you're aware of someone who needs assistance, then just call our main number as always, and they will get the help that they need across the board. Each of our departments, like I mentioned, are doing the regular work plus the calls of reassurance. Our ombudsman have a state mandate to stay outside of long-term care facilities and assisted livings. At this time, they're under a second 30-day order, no entry order, which puts that at the middle of May, and they will be reviewing that as needed. So just to be aware of that, our staff are continuing to provide all the services and more than we usually do. Just give folks our main 471-2096 number if they have any questions. You will see item number 6 with the next meeting. We're asking that all May meetings are also done by Zoom. So please consider making sure that if you're not sure about it looks like everybody was able to get on and such. So please plan on May meeting, this meeting specifically, the RAC meeting, any other meetings that you may normally have with the RAC, with the AAA or PPACG, double check the expectations, but across the board, all PPACG and PPAAA meetings will be held by Zoom in the month of May. So wanted to make sure we said that out loud to each of you so we don't miss that. And that's all I have, Madam Chair.
Dixie, I did have one comment, but it doesn't really fit.
Who is this?
This is Wendy Farr. Thank you, Jody. I just had an interesting experience yesterday that I thought was appropriate to share with everyone. I had and I'm doing air quotes now too, essential situation with one of our kids that lives out of state who got kicked out of his dorm and had to find a job quickly so he could afford to pay for his rent, but had no vehicle. And his car was here. So I towed a car to the state of Utah so that he could find a way to actually get himself to his job. But in the process of being there, our daughter's also looking for a new place to live in a different part of the state coming this fall. And so I just called the AAA there to ask them if they had any kind of a home sharing program, because she has worked with seniors and she would be very good living as a roommate and is actually doing that right now in the St. George area. They had never heard of it, Melissa. It was astounding. It was the most unbelievable conversation that I've had with another agency outside of our area in a really long time. And so just wanted you guys to know that we are the up and coming agency for the area agencies on agency around the entire country, apparently. And it was very exciting to be able to represent us to another AAA elsewhere to and the excitement that she had in listening to some of those ideas. And I just was really invigorated by what it is that you guys do, what we do, how important this process is. And I got the feeling that she was surprised that someone who was on their advisory council actually knew what was going on within our agency. I thought that was kind of cool too. So Melissa, if you could send me any of your info on the home sharing, and I told her I would send that to her. But these programs are really vital. I mean, it's so important. And we had a good conversation, she and I, about what was happening in their state and how they're coming together as well. And it was very uniting. And I just thought that was something that, as all of us, as it feels right now that we're so isolated, that it is, we're not the only ones, but we're all trying to do what we can do for our area and for our seniors and the needs that we have. And I was impressed that I think sometimes we get a little too focused on it's just our area. And Chris, to you, not that it's just Park County or that it's just other areas or just Colorado Springs, or Dave, all that you do up in Tri-Lakes. This is obviously global as well, but I just was really impressed about how this is truly a national problem. And there are other rural areas around our country that are struggling just like ours are. And so it just was a really interesting conversation. And so go us. Yay.
I want to add something really quick, Dixie, if I may. This is Chris Larson.
Sure, go ahead.
A quick comment in regard to, I had emailed Jody about the problem when one of our food pantries got eliminated from the Rocky Mountain, or what is it, Food Bank of the Rockies delivery list. And it was a really big problem. I got a phone call from their director. She was panicked. I said, hey, let me make some phone calls. Made an email to Jody. Within the next day, he'd already responded. So thank you for that, Jody. But I did want to tell you that I did some name dropping when I was trying to get a hold of people at the Food Bank of the Rockies. Yay. And within the day after the next day, I got a phone call from their director to call their director, and they were re-putting them onto their list. And I did throw out y'all's names. So just so you know, they know who we are. So go us again.
Yes.
Yay, good enough. I like that. I like being able to hear good things about our group. Yeah, I have thought about the home share program because I know some other seniors in other parts of the country who are really struggling with having to be isolated. I think that's one of the absolute worst things that we can do to any group of people, but especially people who have given of their lives to everybody, and to tell them now, no, we want to take care of you. We want to keep you safe. So put you in the corner and forget it. Not forget it, because we are meeting needs, but it's so detrimental. Isolation is one of my big pet peeves. So I thank everybody for all that they're doing. I think it's great. Moving on to the calendar of events, like Jody said, next month will probably be all by Zoom, and any future locations, I think the next time we set up a actual meeting probably will be at PPACG offices, because we don't want to go off-site until we're sure that everything is set up as it needs to be. Does anybody else have any other discussion items or anything we need to do?
I don't know if this falls under discussion items. This is Jen with CCHA. I wanted to make everyone aware and make sure that you're spreading the news. 95% of our physician offices are equipped to do telemedicine, and they're doing it very well. In fact, we even have quite a substantial amount of availability within our primary care offices. They have seen a significant drop in patient visits simply because of COVID. So people are not going into the physician offices, so that frees up a lot of time. The telemedicine appointments are very efficient and are billed just like your regular primary care office visit. And they can order prescriptions for you. In most cases, well, in any case, they can even still do your annual wellness exams. So please make sure you spread that information if you have someone who's concerned about having access to their primary care physician. I do see that it is going to change the way that we practice medicine going forward, which is kind of exciting for some of our folks that are in rural areas. And in fact, it's even impacted the ability for us to perform behavioral health visits via telemedicine. So please keep that in mind, especially during times of social isolation. The importance of behavioral health is very key, and there's a great opportunity for us to provide that right now.
Oh, this is good. I'd like to piggyback on that and just suggest that that may be something that the subcommittee, Jen, might want to look at and put together a short report that then can be brought up through the RAC, through the AAA to the PPACG. Again, getting the word out much broader, and it's also something that individual members of the RAC could then disseminate more broadly in their areas. So like a point paper, maybe a one-pager, something like that would be very, very helpful on that.
Yeah, I could put something together for us probably in the next week or two. If we want to partner on that, for those of us who are part of the SRS already, we can kind of meet virtually. I've held off on a lot of that, to be perfectly honest, just because I've not been certain of everyone's capabilities, but seeing participation has been very reassuring and exciting, I think, for us to know that it's a possibility. So, yeah. All right. Thanks, Dave.
Thanks, Jen.
Thank you all. Is there any more, are there any more discussion items that we want to put out there?
I did want to say something. This is Chris Larson in regard to what's happening with extension of quarantines. We do have a telemed, the Conifer Medical Center, which is the only one we have other than the one in Fairplay. What they had suggested in regard to people they are seeing telemed is they're saying that if anybody is immunocompromised and if anybody is over the age, they're actually still saying 65, that they extend their quarantine a full 30 days additionally. That's their advice for that, because there's so many, the definitions, the outcome, the questions, there's so many unanswered questions about the follow through of this. So I did want to let you know that that is something that the healthcare professionals, at least in our rural area, have been stating, that they've been advising that everybody go a full 30 days versus just a 14. And if you're immunocompromised, extend it even beyond that.
Great. Thank you, Chris. Does anybody else have anything they'd like to say right now? Okay, hearing none, I think we've got all the information out there that we can today, so I'll take a motion for adjournment.
I motion.
I'll second.
Okay, who was the second?
Wendy.
Okay, Wendy, thank you all. Any discussion? All right, in favor?
Aye.
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 All right, we'll call it adjourned. Y'all stay safe and well. We'll see you next time.
Bye, everybody.
Bye.